And then someone said, why oral rehydration salts? Why not cigarettes? Now that's alarming, but it actually came from someone from Care International. But the point was, it's not up to us or anybody to say what should be distributed in any particular place or any location. That should be up to the local experts and the local people who have the long-term responsibility for public health in a particular area. So we've gone from tube oral rehydration salts to wedge or aid pod, as it's been called, to whatever products are required in a particular location. So ideas were spreading the idea has been absolutely brilliant at building our confidence in the idea getting challenged and improved in this sort of way. We've gone through various sort of designs, if you like, of this 8-pod, this wedge-shaped container. And we've ended up with Mark III, which looks like this. And this sort of animation that follows will sort of show you how it works. The wedge fits down between the bottles, and it's got shoulders on it that sort of hook just under the top of the bottles. The shoulders also give it a longitudinal strength, so it doesn't twist, it's much stronger. This one's designed to fit widthwise in the crates. So once it's in the crates, it can't burst apart. It can't pop out because of those shoulders. And then when it gets to the other end, it's pulled out, top comes off, and out come whatever's required where that Coca-Cola has arrived. The other design thing is that the top is the same depth as the length of the collar that it fits onto, so it resists being crushed lengthwise as well. So that's where we're at with that idea. Okay, so let's stand back and think what we've got here. We have now got, because we spread this idea about and 10,000 people have had a look at it and commented, not all of them, but a significant number, we've got a universally replicable distribution system. 80% of the Coca-Cola that's produced in Africa goes out in crates and bottles this size. So we've got this thing that could be replicated across the whole of Africa if we wanted to. But this is sandwiched by local determination at both ends. So at the input end, if you like, it's local health professionals. It would normally be a partnership between ministries of health, i.e. government, and NGOs. They determine what's required, when it's required, because what's required may vary from season to season, even in the same locality, and where it should end up. And then at the other end, we've got another bit of local determination. What happens when these pods get to the places that Coke gets to, i.e. most places? They may be put on sale. They may be given away free as part of some sort of campaign, health campaign. They might be picked up by a community health worker and used in a local health program. They might be collected by the local clinic and used in that location. And I'm sure there are many, many other variations on this, but the point is that needs to be determined locally. The other neat thing, coincidentally, that the 8-pod does is it splits the Coca-Cola brand and the Coca-Cola product from any particular social product. There are some social products, like, for example, oral rehydration salts, that would match quite well with Coca-Cola because they're both about rehydration and it works. Other things like condoms don't work so well. When I went to see Salvatore Cabola, he said the problem with condoms is, he said, we tried that. He said the Coca-Cola crates arrived, the condoms arrived, everyone goes, woohoo, the Coke and condoms arrived, let's have a party. It just doesn't work from a sort of PR point of view. But the 8-pod splits, both intellectually and physically, splits the social products from the Coca-Cola product, which is very helpful. Well, where have we got to? Well, after a lot of toing and froing and pressure and so on and so forth, in April this year, Coca-Cola actually committed to doing trials. That sounds wonderful, and it is, I suppose, in a way, but I'm going to play you the commitment. It was broadcast on the BBC. It's an extract, so I think I've extracted it fairly, but if you want the full interview, I'll have to go to the website. The people talking are a guy called Chris Valence from the BBC, he's asking the questions, and a guy called Ewan Wilmshurst, who works in the Global Stakeholder Relations team.
Ewan, you made that announcement. What actually are you planning to do?
As part of a wider trial to look at our distribution system across East Africa, and in fact, ideally, in the long term globally, is to test the idea behind ColaLife, and that is to make use of our distribution system and certainly our distribution expertise to make available health products to people that need them. We're just looking for the right partners, people who are experts in healthcare products and healthcare product distribution. It's not our core business, so we need to make sure we have experts on site.
And any sense of where you might do this trial?
We'll start in Tanzania, probably around Dar es Salaam. The idea is if we can do it in a focused area, we'll get the learnings, what works, what doesn't work, and that ideally can be scaled.
Are you confident that at some point this will become an established part of your business? Do you think that's a prospect? Is that a real prospect?
If we get this right, it could well become a part of the way that we do business, and certainly an expertise that we could share more widely.
Well, I think that's a bit of a result. That's Coca-Cola at global level responding to a bunch of volunteers on Facebook. Reinforces the point that Simon was making earlier on. We can do a lot these days. There are a couple of things in there, lots of wriggle room, as you will have noticed. But Ewan mentioned partnership. Now, while that interview was going on, I was in talks with an international NGO in the States called AED, because one of the things that Salvatore Gabola said to me at the beginning is, we can't do this by ourselves. If we just did this, we would be accused of taking over the public health service and meddling where we're not qualified to meddle. So this partnership was really important. And about a month after that was broadcast, we were able to announce that AED, the NGO in the States, and Coca-Cola were in partnership. And they've started now doing work in Tanzania. It isn't the ColaLife idea, unfortunately. ColaLife is sort of fifth on their list. But at least we've made them think more broadly. The way their response to the business call to action was simply to sell more Coke, but to do it by using women to sell the Coke rather. It was very, very focused on the economic. At least we've made them think now about the social. But we are going to have to do a heck of a lot of work if we want to get this idea trialed, and that's now the focus of ColaLife to get these aid pods produced and trialed.